I'm here, I think in the beginning I was here about every month, and now I'm here about once a quarter. So I'm a nurse by background. I've been a nurse for a little over 20 years. And our goal today is to talk about bedside shift report. I know that's not something new for most of you guys. You probably do some sort of that. Leadership decided that it was just a good time to retrain everybody, to make sure that everybody was doing it in a standardized format, and that everybody had the skills that they needed. And so we're going to talk about the why behind bedside shift report this morning. Certainly want to answer any questions that you might have about it, and then we'll do a little role play of what right looks like, and then we'll give you a chance to do that as well. You're not getting graded this morning, so this is just strictly a chance for you to learn, ask questions, and kind of work through the process. So Angela, I'll let you introduce yourself.
All right, so I'm Angela Lund, also a coach with the Studer Group, and I'm also a nurse. I've been a nurse about 26 years, and lots of bedside experience as well as nurse manager experience. So we'll work together to kind of role play for you, and then we'll turn it around and let you guys practice. And like Nancy said, it's very relaxed, informal. If you have questions along the way, interject them, and we love your feedback. So participate with us as we talk about it.
Okay. So to get us started, I would just love to kind of put a question out there to you. From your practice, from what you've heard, what do you feel like is a benefit of bedside shift report to either yourself or to your patients? What have you seen? What have you heard? What do you feel like is a benefit out there?
It keeps the patient informed of what the plan of care is. It also lets them know that you know what's going on, and that the story that's told of why they came and what we're doing, and it's shared between all, so everybody's on the same level.
Absolutely, and that's a great reason for bedside shift report. Oftentimes our patients, we hear complaints from them that there were so many different people in my room, and I wasn't sure that they were giving me the same information. And so whenever we can come together and share that information in a uniform front, it really makes them, gives them confidence that we're a team and that we know what's going on with them. So absolutely great point. What else?
Sometimes when you're looking at your patient, it's easier to give report because you're looking at them and thinking about all the things that they have. If you're not in the room, sometimes it's easy to leave out, oh yeah, they have a Foley and you know, whatever.
Have you ever had to call the person that gave you a report and they're at home and you're worried that they're sleeping, but you've got to know the answer? That's a great way to not have to do that, because like you said, you're both in the room and you're looking at everything while you're talking.
Or have you ever gone into a patient's room after you've gotten a report out in the hallway, and the patient looks nothing like the report that you got? And you're like, wow, this is not at all what they told me. So being able to go and lay eyes on them at the same time, as well as for some of our new nurses or nurses that maybe you come into a patient's room, there's a new piece of equipment, there's a new dressing that you've never seen before, and you're kind of on your own versus having somebody that's giving you a report that they may not be more tenured than you, but they've at least had 12 hours experience for whatever this new thing is, and it gives them a chance to mentor and train you as well with that, whatever that new thing might be. So great point. What else?
I think safety is the right drug infusing at the same rate that you were just told it was infusing at. Do they have a pressure ulcer? I mean, if they've got a pressure ulcer, it probably requires 2 people to turn them to see it. So you've got that extra pair of hands, which it's hard to find once everybody's gone. Another pair of hands, and just their IV sites aren't infiltrated, so you know what you're walking into when you bring those meds and back in to do your assessment. So.
Absolutely, we've heard time after time of nurses going in, and maybe the IV wasn't running at all, and you got a report that it was running, or it was infiltrated, or it was the wrong medication that was running in. So being able to go in with another nurse, lay eyes on it, this is what it is, check it with that as well. Doing your patient identifier checks together is also just a great way just to prevent any possible safety issues or concerns. What else? We talked about safety, just showing that teamwork and the communication, giving the patient a chance to contribute. We wanna make sure and pull them into the conversation. There's some patients that are gonna just naturally jump into the conversation, and some where we're gonna have to say, you know, hey, Mr. Smith, you know, why don't you tell Cindy a little bit about what we did to help manage your pain last night? Just pull them into that conversation, so it's not just, you know, Angela and I over here talking about Mr. Smith, but it's really kind of a three-way conversation that we're having about his care, her care, to bring them into that. My hope would be that bedside shift report is something that doesn't take you a lot longer, or any longer than give a report not at the bedside. What we see is a lot of those reports, we tend to add additional information, whether it is just your feelings on the patient that you're caring for, or how are your kids, how was your vacation. So report tends to get a little bit longer because of some of those kind of things. So at the bedside, it's strictly about the patient, it's not feelings, it's your just, you know, objective assessment of what's going on and sharing of that information. We ask that whoever has the nurse, whoever is going off shift, that they try to get into the room about an hour before bedside shift report and go ahead and do that final hourly round on them. That way you're addressing bathroom needs, pain medication needs, that kind of thing. So when you're in there getting bedside shift report, you're not spending a lot of time doing that. And we want to address those, but hopefully that nurse has had a chance to go ahead and manage that prior to bedside shift report, if that makes sense. What else, Angela?
Let's see, I think an important point too is we've done a lot of studying over the years. It seems that many patient events happen during report shift change. And if all of the nurses are at the desk, sometimes it's an hour, hour and a half before any patient gets seen. So it's really a good way that you're integrated with the patient still. They're not feeling that hour gap or 2 hour gap during shift change. So you can prevent falls, you can prevent a lot of things like that that we see happens frequently during shift change.
So guys, I know you guys just came in. We're talking about really the benefits of bedside shift report, what you've seen that benefits the patient and things that have benefited yourself doing bedside shift report. Anything you guys want to add to that, or from your perspective, what you've seen as the benefits of that?
I just heard your comments about the patient being involved. Some patients, a lot of patients don't, but I mean, they are more involved. And it makes the shift before you own up to what they're leading you and what you're walking into.
Yeah, helps us really be accountable to what's going on, that we've done what we've said we did, and we've taken care of things that we need to take care of as on our shift. So absolutely, great point. Anything else?
I'm brain dead, don't ask her. I'm just gonna go listen. It's been a morning.
So just to summarize, shows great teamwork, that we're all sharing the same message. We're giving the patient a chance to contribute and be involved in the report. We are doing safety checks to ensure that we are, ensure that the IVs are going like they're going, that the IV sites look good, we're checking all drains and tubes and that kind of thing. Looking at pressure ulcers together if that's an issue. Going ahead and addressing, like you're doing an hourly round while you're in there. We really want another big important part of bedside shift report is managing up the oncoming nurse. And so as you go in, if you are off-going, being able to say, hey, this is Angela, she's gonna be caring for you for the next 12 hours. She's a great nurse, she's gonna take great care of you. Because you've already established that relationship with the patient, they trust you, hopefully. Hopefully your relationship has gone well, and you being able to manage up that person gives them confidence that this new person that I've never met is gonna take care of me. So we want to do that as well. If you have a patient who has family in the room, best case scenario, you're able to have a conversation with the patient prior to the family being there to let them know we do give report at bedside during shift change. We share a lot of your information and history at that moment. Would you like me to ask the family or your visitors to step out when we do that? If you don't have a chance to ask that question to the patient, I would go ahead and just say, we're here to do bedside shift report. Would you guys mind stepping out for a few minutes? The patient can always overrule you and say, oh no, it's fine, they can stay. But that way it doesn't put the patient in an awkward position if they don't want everybody from church to hear about their GI bleed and all of that. So it just kind of takes that off their plate, and then they want them to say they can, of course, stay. So, any questions? No questions, this is a quiet group.
I know.
Y'all need to have some candy or something.
That's all right. Does anybody have any stories from doing bedside report, things that you kind of stuck in your mind of? No?
Okay.
All right.
What we'll do is we'll do a little role play. Do you want to be the patient? You want me to be the patient?
Either way, what do you prefer? How about, why don't you be the patient?
Okay, I'll be the patient, and if somebody can come and receive a report from Angela on me.
I'll do it.
Okay. And so what we'll do, Terry, after we get done doing this role play, we'll let you give report to somebody else here.
Okay.
And then after you do that, after you give report, you're welcome to leave. So if people need to kind of get back, they'll,
All right, that's
feel free to
fine.
just volunteer and
So
then
I'm
we'll-
getting a report? So I'm the
I'm
oncoming
off going,
shift?
you're oncoming.
Come in.
I'm gonna hit the hand sanitizer. Nancy. Hi Nancy, I'm back. As I told you a few minutes ago, I was gonna bring in your new nurse for the day and introduce you. This is Terry. And Terry's gonna take great care of you today. She's been a nurse for 24 years and I've worked with her for the past 2 years and she's just one of our great team members.
Awesome.
So we're going to give a bedside shift report now, and we're gonna be talking about the things that we've done during the night, as well as kind of your plan of care and things. So what I want from you, if you're willing to, participate with us. We wanna hear from you and ask any questions or add anything that I forget.
Okay.
Does that sound good?
Yeah, yeah.
All right, so why don't we start by checking her ID bracelet? Can you tell me your name and date of birth?
Nancy Rada, 512.
All right, very good. And as we talk, I'm gonna update your whiteboard.
Okay.
Okay?
Great.
All right, so I'm gonna write Terry's name. She'll be your nurse today, and your patient care assistant is, Jennifer. So I've got, your pain medication written here, the last
Okay.
time you had pain meds. She can have it every 4 hours, so, Terry's gonna be checking with you throughout the day, and she'll update that as each pain medication time.
I'm
So-
hurting right now.
You're hurt now? What's your
Yeah,
pain
it's like a 10.
score? A 10 now?
Yeah.
Okay, it's been a couple of hours since we gave you anything, so why don't we, as soon as we're finished talking, I'll go out and get your pain
Okay.
medication. Does that sound
Yeah,
reasonable?
that sounds good.
All right, great. So, Nancy's history, she came in 2 days ago, had surgery on her belly. She had a bowel obstruction, but now they've resolved that. NG2 came out yesterday and bowel sounds are, starting to wake up. So, then I would kind of give you any other past medical history. I'm not gonna make anything up.
Okay.
Then we'd move into the assessment, so this is her recent vitals, this is, lung sounds, hearts, you know, you can follow your normal routine, how you go through your assessment during report, okay? So after we've gone through the assessment, why don't we look together at her IV site? She's got a 20 gauge in her right forearm. How does that feel, Nancy? Is it still feeling
Yeah, it's
okay?
fine.
No pain
Yeah.
or burning?
Mhm.
Okay. IV fluids are running at 100 an hour, and I just changed the tubing during the night, so you should be good to go for your shift. So plan of care for today, pain medications, we're starting to, do a ice chips clear liquid, so as her belly starts waking up, she's gonna be listening to your, bowel sounds frequently, and as long
Okay.
as they keep doing what they're supposed to do, she'll increase your fluids, and then hopefully we'll get you eating by the end of the day.
Okay, good.
Let's see, what else can I tell her, Nancy?
You know, that antibiotic made me really sick.
Okay.
So, you know, just when I get that, maybe give me something to help with the nauseous.
This sounds great, we've got some Zofran that we can give
Yep.
you before that. She only has 2 doses left, so maybe an hour before she hangs out, we'll give you that
That would be
medication.
good.
Does that sound like a good plan?
Mm-hmm.
All right, so we expect your doctor to come around this morning and do rounds. Usually comes between 8 and 10, but sometimes depending on their surgery schedule and things like that. But, when they come on the floor, they typically round with the nurse, and so, we'll give you a heads up when we see them on the floor, and that way
Okay.
you can expect them. Plan for the day, like I said, we're just gonna try to get you eating, we'll get you up and walk you a couple times today, you'll have physical therapy, they'll come in and help you with that as well.
Okay.
Any questions about anything for today's plan? All right, well, thank you so much. I've enjoyed taking care of you tonight.
Thank you.
Terry's gonna take great care of you. Okay?
Okay, Nancy, I get to play hide and seek. I need to see your incision, please.
Yeah, and you know, good point. So we would have assessed her
Yeah.
belly
It's
and
all good.
dressings and whatever together while you're at the bedside. All right.
Anything, that you guys feel like they, could have covered better, could have covered differently with their report?
I can tell you one thing I know I forgot. I didn't assess her environment, so I'm gonna make sure her call light's in reach, her table's in reach, she's got her over bed table, trash can closed. Talk about don't get up without assistance, call us, things like that. And then as we're leaving, we're gonna always ask, is there anything else I can do for you? I have the time. Hit the hand gel, and then, you know, give her expectations about when you'll be back. So you're gonna get report on the rest of your patients, and then you'll be back. I'm gonna go out and give her pain medication right now, because that way it frees you up to move on with your other reports.
Yep.
All right,
Questions?
any questions?
All right,